How to save your body from pain, injuries, and costly surgeries in just 30 seconds a day. Have you ever imagined saving $50,000 in just 8 minutes of your day? Sounds like a deal too good to pass up, right? But that's the kind of choice you're making when it comes to taking care of your health. Believe it or not, the cost of back surgery is higher than most people's yearly salary, and sadly, 4 out of every 5 people will experience debilitating back pain at some point in their lives. But your back isn't the only part of your body that's at risk. There are several other critical areas that could be silently affecting you as well. In this video, we'll explore the 5 key areas of the body that are most vulnerable to injury and pain. We'll dive into simple, proven exercises that take just minutes a day to help you avoid expensive medical treatments, surgeries, and a lifetime of pain. And trust me, these exercises are easy, effective, and can be done from the comfort of your own home. Let's begin. 1. The silent force of gravity. Why your spine needs attention. Have you ever noticed how, after a long day, you feel stiffer and maybe even a little shorter? This isn't just a random sensation. It's gravity constantly pulling down on your spine, leading to compression over time. This compression is the main culprit behind chronic back pain and can even lead to the need for back surgery. Imagine carrying a bowling ball on every square inch of your body, 24/7. That's the force gravity exerts on your spine. Even while you sleep, gravity is still at work. But here's the good news. NASA made a fascinating discovery when astronauts who spent extended periods in space returned to Earth. They were actually taller, and their backs hurt less. Why? Because in space, without the constant pull of gravity, their spines decompressed naturally. The lack of gravity allowed their vertebrae to expand and reduce compression. You don't need to become an astronaut to enjoy these benefits. There's a simple exercise that mimics this anti-gravity effect, the dead hang. This exercise decompresses your spine in the same way astronauts experience in space, and it only takes 30 seconds a day. How to perform the dead hang. 1. Find a secure overhead bar. This can be anything from a pull-up bar to a tree branch or sturdy doorframe. 2. Grip the bar firmly with your hands shoulder-width apart. 3. Let your body hang naturally, relaxing your shoulders, back, and hips. 4. Hold this position for 30 seconds to 1 minute each day. Doing this exercise regularly will relieve pressure on your spine, improve your posture, and prevent long-term damage. If you can work your way up to a minute a day, that's an excellent goal. For those over 40, 2 minutes is a great target. But remember, your back is just the first of 5 critical areas at risk. Let's move on to the next one, your knees. 2. Knee health. Preventing injuries with a simple exercise. Knee replacement surgeries are expensive, costing upwards of $45,000. And if you've ever experienced knee pain or injury, you know that recovery can take months. For athletes, especially those who play sports like soccer, knee injuries can be devastating not just to their career, but to their livelihood. Several years ago, professional soccer teams faced a huge problem. Their top athletes were suffering from knee and hamstring injuries, causing months of painful recovery and costing the teams millions. But then, a little-known exercise came into the spotlight, the Nordic Hamstring Curl. FC Barcelona, one of the world's top soccer clubs, adopted this exercise, and within no time, injury rates dropped by more than 50%. Coaches and medical experts around the world took notice, and soon elite athletes everywhere were incorporating this simple move into their training routines. How to perform the Nordic Hamstring Curl. 1. Kneel down and secure your ankles under something stable, like a heavy couch, or have someone hold your ankles. 2. Keep your back straight and slowly lean forward, fighting against gravity as long as possible using your hamstrings. 3. When you can't hold it any longer, gently catch yourself with your hands, then push yourself back up and repeat. This exercise strengthens your hamstrings, which are essential for knee stability. It's a great way to prevent injuries and protect your knees for the long term. But, like any new exercise, ease into it gradually. It's incredibly effective, but you want to make sure you do it safely to avoid strain. Now, let's talk about your shoulders, specifically how poor posture can lead to unnecessary pain and potential surgery. 3. Fixing shoulder pain and improving posture with face pulls. A young guy named David spent years hunched over a computer without even noticing the damage he was doing to his body. He woke up one morning with a sharp, nagging shoulder pain that wouldn't go away. His doctor explained that the real issue wasn't a sudden injury, but rather years of poor posture slowly taking a toll on his shoulders and neck. This kind of damage can eventually lead to expensive shoulder surgeries and long recovery periods. Luckily, David didn't need to undergo surgery. He discovered a simple exercise called face pulls, which completely eliminated his pain and improved his posture. How to perform face pulls. 1. Attach a resistance band at eye level to something sturdy, like a door handle. 2. Grab the band with both hands, palms facing inward. 3. Pull the band toward your face, bringing your hands beside your ears and squeezing your shoulder blades together. 4. Slowly return to the starting position and repeat 10-15 times. Face pulls are perfect for strengthening your upper back and shoulder muscles. They also help pull your shoulders back into their natural, pain-free position. Doing this exercise regularly can prevent shoulder pain, fix poor posture, and reduce the likelihood of future injuries and costly surgeries. 4. The core connection. Strengthening your spine with the McGill Big Three. Back pain is one of the most common health complaints worldwide. Dr. Stuart McGill, a world-renowned spine specialist, noticed that many patients who underwent surgery still experienced pain because the root cause, weak core muscles and an unstable spine, was never addressed. So, he developed 3 simple exercises that could strengthen the core and stabilize the spine, reducing pain and preventing the need for surgery. These exercises became known as the McGill Big Three, and they've become the gold standard for treating and preventing back pain. The McGill Big Three. 1. Curl up, lie flat on your back, bend one knee, and keep the other leg straight. Place your hands under your lower back and gently lift your shoulders off the ground without bending your spine. Hold for 10 seconds, then slowly lower down. Repeat 6-8 times. 2. Side plank, lie on your side with your elbow directly under your shoulder. Lift your hips off the ground to form a straight line from your head to your feet. Hold for 10 seconds, then lower your hips. Repeat 3-5 times on each side. 3. Bird dog. Start on your hands and knees with a flat back. Extend one arm straight out and the opposite leg straight back. Hold for 10 seconds, then return to the starting position. Repeat 6-8 times per side. These exercises focus on strengthening the muscles that support your spine, improving stability, and reducing back pain. They're easy to do and require minimal time, but they're incredibly effective in protecting your back for the long haul. 5. Glutes. The key to unlocking full body strength. You might not realize it, but weak glutes can cause all sorts of issues in your body, from lower back pain to poor posture and even fatigue. Strength coaches and therapists have long known the importance of having strong glutes, and one exercise they swear by is the glute bridge. How to perform the glute bridge. 1. Lie flat on your back with your knees bent and feet flat on the floor. 2. Place your arms by your sides and press through your heels to lift your hips off the floor. 3. At the top of the movement, squeeze your glutes hard for 3-5 seconds. 4. Slowly lower your hips back down and repeat 12-15 times. This exercise reactivates your glutes, helping to relieve tension in your lower back, loosen your hips, and give you a lighter, more powerful feeling. The glute bridge is a simple yet highly effective way to improve your strength, mobility, and overall body function. Take charge of your health with just minutes a day. By incorporating these simple exercises into your daily routine, you can protect yourself from costly surgeries and avoid years of pain and discomfort. Whether it's decompressing your spine with the dead hang, strengthening your knees with Nordic hamstring curls, improving your posture with face pulls, stabilizing your spine with the McGill Big Three, or activating your glutes with glute bridges, you have the power to transform your body in just minutes a day. So, what are you waiting for? Make these small changes today and enjoy the benefits of a pain-free, active life for years to come. It's time to invest in your health. You won't regret it.